might not think that there's much to do with health and safety in your beauty salon, your barber shop, your hair restoration center, or wherever you may work, because the center of what we do is the client. However, any smart business, successful business that is going to make sure that you pay close attention to how you maintain your health behind the chair. Hi, I'm Stephanie Anderson, and welcome to Main Health. Now, I've been in the beauty industry for over 2 decades, and I have learned for myself after many long days behind the chair, standing on my feet day in and day out, repetitious work with my hand, that there has to be something better. Now, I wish back many years ago when I started on my journey that I would have had someone to help me, someone like my guest here today. Today, I'm welcoming and introducing to you Dr. Arnaldo Gutierrez.
Thank you very much.
Thank you so much for coming. Let me ask what exactly that you do as a clinic director and chief administrator for Spine and Health Institute. What do you do there?
Well, that is our main business where we take care of people that have pains. That's where we're going to deliver chiropractic, the acupuncture that we deliver, and even in nutrition. Because a lot of people, they may not eat well,
Yes.
but they don't take supplements.
Yes.
And so a lot of times we just kind of ignore ourselves, take care of everybody else. Then when we totally break down and we can't keep doing what we were doing, that's when we want help. So at Spine and Health Institute, we take a look at how we want to just complement everything. Take care of the presenting problem, whether it's knee pain, back pain, my feet hurt, whatever it is, but at the same time, start taking little steps towards health. So that's what we do there.
It encompasses the overall health of a person. People want, like you said, address just different parts of it, but we're a total one. And a lot of times people don't consider supplementation to be nothing but an add-on, but actually it is another form of food. I consider it to be something you need to eat every day.
And that's just how it is, right?
Yes.
We have a tendency to ignore a big part of that, because a lot of times when you're very busy, you eat on the run.
Yes.
And you don't really pay attention to exactly what you're putting into your body.
True.
But your body knows what it's getting.
Yes.
And it'll be reflected later when this happens or that happens.
Yes.
And so we have to make really good choices, but a lot of times the public at large just doesn't have that information from a reliable source of what it is. And unfortunately, sometimes you can go and think you're doing the right thing buying this supplement that's the cheapest one you can find, and you don't really realize that you're getting the bottom part of what quality is.
Yes.
So sometimes you don't necessarily have to spend the most, but you just definitely want to make sure you're getting the best quality.
I always tell people it's an investment in yourself. We know, because we're in the industry, that absorbability, you're just not taking it, but that supplement actually has to be absorbed throughout your body to be able to do what it needs to do within your body. So it's just not about the price tag, and some brands are better than others, but you really have to pay close attention to what it is that, not only with the food intake, but even the supplements and things that we're doing. Let me ask, what made you want to go into chiropractic?
That's a wonderful story. My parents came from Cuba in 1966, and I was born in '67. And when you come from a foreign country like Cuba and you come here to the United States, this is definitely we always consider it a land of opportunity. And I consider it a land of opportunity and blessings, because my family has truly been blessed. My father always, taking care of the family and things like that. I remember when I was a sophomore in high school, he sat me down and he was telling me, look, in a couple of years, you're going to graduate from high school. And, I want you to start thinking about your future and about choices that you need to make. Don't have a lot of money, so if you decide to go to college, he would support me as best he could.
Okay.
if I decide not to go to college, then you know what? You got to get a job and
Okay.
start paying bills.
Yeah.
And it was kind of like one of those talks. And so guess what? I
Yeah.
opted for college.
Okay. Okay.
And in doing so, I went to my student counselor in high school, which is right here, Robert E. Lee High School.
Okay. San
And
Antonio.
I went and I asked them for three things. I wanted to look at chemistry to
Okay.
become a chemist. I wanted to look at doctor of chiropractic, and I wanted to look at doctor of osteopathy.
Okay.
And when I looked at all of those, for me, what I just love helping people without using drugs, without
Yes.
having to prescribe medications, without having to do surgeries,
Yes.
chiropractic was just the fit for me.
Yeah. They are also raising another future doctor of chiropractic in their house. So that's very awesome.
Yes, wonderful blessing to have my youngest son
Yes.
tell me that he wanted to follow in my footsteps.
That's huge.
And so we're guiding him to be able to do that, and he's off to a really good start.
I was really intrigued with how the correlation between your practicing martial arts and deciding to practice into the with the needles,
acupuncture.
The acupuncture.
Well, depending on the discipline, there's a
Okay.
lot of disciplines in martial arts, but in the discipline that I was practicing, we were learning some, they call them points, these strike points.
Okay.
But it turns out that a lot of these strike points were actually acupuncture points.
Wow.
So it was just a natural fit for me to look into that. And then it opened up a whole new world in the sense because in the martial arts discipline, breathing is important. But it's also just as important in helping a person get healthy. So in acupuncture, it is considered that life energy, they call it qi, begins in the lungs.
Yes.
But a lot of times we don't even breathe deep. We spend our whole day just shallow breathing, getting
Yes.
through the day. So we don't take that time, just take a deep
Yes.
breath and let it out. And if you did that every day, just a little bit, especially in the morning, first thing, you're gonna notice you have higher energy throughout the day. So that's just one of those tips that I learned because in my journey, my life
Yes.
journey, it just turned out that, hey, this just makes perfect sense.
And it's so sad that the things that we take for granted, there's simple things that we can do to make our life and our health better. So just breathing in and out is going to make a world of a difference in how the rest of your day takes place. I have to be transparent here because I'm just totally geeked and excited about you being here today because I want to help the viewer to not do what I did when I was, in the salon day in and day out. When I first started at a professional, being cute, wearing the heels, doing hair, wasn't worried about a stress mat, doing things that ultimately after time, because you don't always see it when you're doing it, but later on progression, having back problems and different things that manifest as we mature. I'm not going to say get older. Dare not say that. But those things that happen to our bodies that I'm really excited for you being here because Dr. Gutierrez is going to have a segment, our next segment, matter of fact, where he's going to show and do some demonstrations on how we can maintain our health behind the chair. Our feet, he's going to show us things about our feet, our back, and just a lot of information that we're going to be able to do in a demo when we return.
And not only just that, but what we're talking about also is taking that stress off the body.
Yes.
That stress that we put on the body. Now, we feel that at the end of the day.
Yes.
Some people wake up and they already have that stress.
Yeah.
And they're tired when they already get up. So it's normal to feel a little bit of tiredness, but when you incorporate these next tips that we're going to do and these next demos, then you should feel less stress and tension throughout the day. And at the end of the day, you should feel a little bit more energy because that's what it's about, right?
That's what it's about.
At the end of the day, you want to spend time with your family. And if you're all drained and tired, are you
Yes.
giving them the quality of time that you want to give them?
And that's what we're going to do next. We're going to break for our next segment. And when we come back, My shoes are going to be off. And Dr. Gutierrez and I are going to clear the table back or whatever it takes in order to show you some special tips on how to stay healthy behind the chair. This is Stephanie Anderson, Maine Health, and we'll be right back. And welcome back to Maine Health. This is a segment that I promised you earlier where Dr. Gutierrez is going to do some actual demonstrations to help us to work more effectively and efficiently and save our bodies. However, we have an added surprise. I was able to draft from the audience his beautiful wife, Lorena. So she so graciously decided to help us in this demonstration. Hello, Lorena.
Hello. Hello, Stephanie.
Now, if you would just kind of humor us, this is not, of course, a hydraulic chair that I would use in my hair restoration facility, but we're going to use this makeshift chair to kind of show you some things. So Dr. G has asked me to kind of show what I would do in a normal day, correct?
Correct.
Okay.
Correct.
So, if this were a hydraulic chair, I would position the client so the height of the chair would be, comfortable for me. So during the styling, I know over time that I try not to do too much bending. So I try to use the chair to move around. So I may move her depending on what side it needs to be done. Or sometimes I have to move my body as well. So if I'm doing a blow dry or something, you may see a lot of repetition and moving my hands, or if I'm doing curling, just may doing a lot of wrist action, which I can feel it at the end of the day. Or it just depends on whatever the service is. But a lot of times, where I feel more uncomfortable is at the shampoo bowl. When the client is reclined back and I'm down, trying to do manipulations, and I can feel it in my back and sometimes in my wrist. So that's pretty much what it is. I do try to use a chair, Dr. G. I see the critique coming, people. I see it coming. The wheels are rolling. So what do you suggest that I'm not going to say doing wrong, but you would suggest I could do in a better, more efficient way for my body?
So let me tell you, when I'm going to work with somebody,
Okay.
I have to position and I have to frame this in the right way.
Okay.
I'm not coming in to tell you how to do what you do,
Yes.
right? You're the expert at what you do, and I'm going to be the expert at what we called bionomics.
Okay.
So a lot of people have heard of ergonomics, right? So that's when you set up your station and
Yes.
it's set up the right way. But bionomics is when we are looking at how the person actually uses it. So the bio being the person that we want to care for.
Yes.
So you can have an expensive setup at work. You can have the most expensive chair, but if you're not using it right, does it really matter?
That's right.
So to understand a little bit about what your body is doing, you have to actually have a little bit of knowledge of what your body position is.
Okay.
We want to look at proper posture.
Yes.
But you got to understand what proper posture means.
Okay.
So the neck, there's a curve in the neck that goes forward when you're looking at from a person from the side.
Okay.
Okay. Now, in our society, we have a problem that a lot of kids are looking down right now,
Yes.
right? So
Looking at the video
they're
game.
looking at the cell phone. They call
Yeah.
it text neck syndrome. Okay. So we definitely need to keep our head level.
Okay.
Okay. While we work. Now you use your eyes to see what you're doing.
True.
But you shouldn't be looking down all the
Okay.
time. Okay. So maintaining that posture.
Okay.
The other one is this. If I look at your arm, this right here,
Okay.
with your arm in this position, this is what we call neutral posture.
Okay.
Your arm is best here. If you do this, all of the weight of your arm has to be transferred to this and to your neck. So do you ever feel that tension up in here?
Yes.
That's what produces that.
Yes.
Okay. So if you're able to work here, this is way better than here.
So positioning in the chair. So to make sure that the client is to where that I can make sure that it's at the proper angle.
To let you do what you need to do so that
Yes.
you can do it a lot longer.
Longer.
Okay. We call it that we want that body that you're living in to last you the lifetime. Okay. We don't want you to hit into those upper
Yes.
60s and 70s
Yes.
and have to depend on someone else to take care of you.
True.
Well, Why is that? Well, in my early days of practice, I saw people coming in with problems that could have been prevented.
Yes.
That's why I wanted to do injury prevention.
Yes.
I wanted to be that chiropractor that's not just in the office, but ready to go out and customize something for somebody so that that body can last a lifetime.
Yes.
Now, here's the thing.
Okay.
We've got you here,
Okay.
right?
Yes.
And now you mentioned that you have to work here and you move around, which is great. But I have actually seen, when I've been getting my hair taken care of,
Yeah.
I've seen stylists twist their spine,
Oh, definitely.
right? And all it matters is this. When they twist that spine, whether they're twisting and they're working this way, all they had to do is reposition their feet.
Okay. Reposition your feet. Okay.
Reposition your feet. So if you move your feet and you keep your shoulders and your pelvis in the same plane,
Okay.
you're not twisting the spine. So here's what happens. Every time you twist the spine, you're putting torsion on the spine and the discs. And you don't
Don't
feel
want it.
it
Okay.
because the discs don't have any nerves inside.
Okay.
So a lot of people have heard of, I've got a pinched nerve,
Nerve.
right?
Yes.
Well, that's when the disc pinches the nerve. You can have a muscle
Wow.
pinch the nerve and things like that, but most common, the disc pinches the nerve.
Wow.
What happens is the disc moved out of place, whether it was a herniation or it changed, and now it's irritating the nerve. So we can avoid that by using our proper posture.
Okay. So putting your feet together and instead of,
Well, you want to keep your feet maybe shoulder width apart.
okay.
I kind of look at it this way. Remember I talked to you about sports injuries, right?
Yes, yes.
And here's one of the things that I've learned. There are different kinds of athletes, okay?
True.
You can be a hairstyle athlete, and you need to prepare your body as an athlete to do this job.
All
Because it's
right.
not a few hours a day,
True.
right?
Yes.
And what do athletes do when they're going to prepare?
They train.
They train and they stretch and they
Yes.
warm up.
Yes, they do.
So there's certain things as a stylist that you're showing me that you cannot avoid.
Yes.
Okay. There are certain things, if you're going to design your own studio and you're saying, hey, every time I've got to go down to wash someone's hair, I've got to bend down.
Yes.
Has anybody ever thought about maybe raising up that basin a little bit?
Yes.
So the higher you bring that basin up and you can get there without having to bend
Bend down,
forward,
yes.
that's less stress on your own spine. Because that spine has to last a lifetime.
Yes.
So little things like that. But what if I can't do it? What if the basin is where it is because this is the job I have? Well, our athletes stretch to prepare. You've got to be able to stretch to prepare for your workday.
Okay.
And throughout the workday, you should be able to stretch. If you take a little stretch break,
Okay.
now that's not like I'm going to leave you, I'll be right back, right?
Yeah, but in
That's a little stretch break.
in between.
Obviously, you're not going to do it when you have a client in
True.
the chair,
Yeah.
but you can do little stretch breaks to help reset
Okay.
the bones in the neck, to reset the spine, things like that.
Okay. What would be something as far as a stretch exercise that I could do? You said stretch the neck. What would be something that I could do?
Let me tell you what you shouldn't do.
Okay.
That I see people do all the time.
Okay, okay.
So a lot of times, like if you've been working, you've been
Yes, that happens a
shampooing the
lot.
hair,
Yeah.
you're bending forward, the discs are being pushed out the
Yes.
back. So what a lot of people will do is they'll go like this and they'll stretch the back that
Back.
way. But that does not reset the disc.
Oh.
You actually have to take pressure off the spine and then go back.
Okay.
So the way we do it is like this. Put your hands on your hips.
Okay.
You're going to push down on your hips, bringing your upper body up, and then you're going to lean back just a tad.
I can feel that.
By taking that pressure off and
Mm-hmm.
then leaning back, you're not only giving a good stretch to the lower back, but you're recentering that disc.
Okay.
So that is way more effective
Okay.
than just going back,
Back.
right?
You see that? Yeah.
Yep.
I
yep.
feel it.
Now, when it comes to this, now I do notice, and I think your
Okay.
audience noticed, you change your shoes,
Yes.
right?
Yeah.
So that brings up another point because what are you standing on?
Currently, the studio floor. But when you talked about ergonomics, Dr. G, I do have a stress mat at my facility.
And that's excellent because it's going to reduce some of that
Yes.
stress and tension that those poor feet get.
Yes.
A lot of stress and tension on the feet.
True.
Not a lot of love.
No.
Right?
No.
But here's the thing that I see a lot of times. A lot of times people who have pains in their feet and pains in their knees are actually wearing the wrong shoe. Wrong size
Yes.
or just ill-fitted.
Yeah.
And here's what happens. When you get measured for your shoe. A lot of times people will look at the size of the shoe based on the heel to toe length. But there's also the heel to that bunion area, okay? So let me
Who
look at this
knew?
real quick. So here we have a model of a foot.
Okay.
Okay. So if you look at heel to toe, that could be a certain distance.
Yes.
And then heel to this part of the foot, which would be like that ball of the foot.
The ball.
Sometimes this is longer than the toe length.
Wow.
Because if you have short toes, you might think, oh, well, I need to be in a different shoe. But you have to take attention to what is the heel to this bone length.
Wow.
Okay. Because that might mean you're in the wrong
Wrong
shoe.
shoe.
And also pay attention to the width of it.
Okay.
And here's what does happen. People do forget that
Yeah.
as we get older,
As we mature.
our feet do change.
They do.
So
Yeah.
just because you were a size 8.5 when you were 18, doesn't mean you're an 8.5 when you're in your
Your
50s.
feet get smaller.
They have a tendency to get wider.
Okay.
Okay. So if you have to make those accommodations.
Yeah.
So having the right shoe
Yes.
is very important, especially when you already have the mat that helps you protect.
Yes.
Right. So having those things in line, less stress and tension,
Okay.
more energy at the end of the day. Because here's what happens. When you put stress and tension on a muscle, the blood flow to that muscle drops.
Okay.
There's science behind it. It can tell you, like, if you did it for so long, it drops by 30%, 50%, 70%.
Okay.
So going back to stretching is the best way to get that blood flow back into
Okay.
the body.
Okay.
When you have more blood flow, you have more oxygen.
Yes.
You have more oxygen. At the end of the day,
You feel
have
better.
more energy.
Yes.
Okay?
Yes.
And that's what it's about, whether you're here or at home.
Okay.
Because a lot of times we're looking at this, right?
Yes.
But what about at home, doing the dishes? At home, ironing?
Yes.
You know, any of those things, when you're putting your body outside of the proper posture, you're
It
putting
affects
it
your
at
health.
risk for increasing stress and tension.
Yes.
Increased stress and tension, after a while, it's going to hurt.
Yes.
That's when we want it gone in a day, right?
That's true.
So what we want to do is definitely look at how you can optimally perform your duties here, right? Because at the end of the day, if you're hurting, you're not going to feel so well.
No. No.
Okay.
You don't have the best quality of life, and that's
Exactly.
what we all want.
And we want that back. We definitely want it
Yes,
back.
yes.
Because life is too precious to lose a minute
It is.
on anything but happiness and joy.
Well, I appreciate the fact that in your business that you know, some people just want to treat the illness, but you actually want to show how to prevent it. And that is good. And they're just simple rules and different things that we have to change in order to do that.
Right. And that's just the way it is. Because a lot of times we don't have the knowledge. Once
True.
you have the knowledge, then it's up to you to
True.
follow it through, right?
True.
But here's one of the things that we have in common. If I ask you to fold your arms, go ahead and fold your arms for me. Did I have to tell you how to do it?
No.
Because you've probably been doing it since you were little.
This way.
And your parents told you to clean your room and
Yeah.
you weren't going to do it,
They
right?
didn't see me do it, but I did it.
So here's the thing. Fold
Yeah.
it the other way.
I don't.
You have to think
I
about
have
it.
to think about it.
So
Yeah.
that's what happens.
Yes.
When we're teaching somebody something new, it's not the same way.
Yes.
You have to learn the new way. It may not feel correct.
Yes.
Some people have told me, well, I'm going to be slower. You're not going to be slower. Once you practice it and you make it part of your normal routine,
Yes.
you're going to be faster or just as fast as before.
Just got to practice doing it.
Got to practice. So when you're here and you're looking at somebody, you see how that's different, okay? And we have to avoid the twisting,
Yes.
okay? So
Avoid
that means,
the twisting.
That means you have to definitely move your legs
Yeah.
and you move around
Yes.
the chair that you need to move around.
Okay.
And we always have a tendency that if we're going to talk to somebody, we lean in. And in reality, we should actually open up and come
Okay.
down on the legs.
Okay.
I know it's very different.
Yeah, because they tell you to, give people eye contact, and if they're sitting, you think you need to
Right.
lean in.
You think you need to lean in.
Yes.
But all of that leaning in, that's pressure
Affects
on your
your-
own spine.
Understand. Okay.
So if you can use your legs,
Okay.
you're better off. Because everybody's heard the rule, use your legs and not your back.
Good question, and brings us to the point. I want you to use the measurement tool. Were you going to use that for the foot? And also, this is for anybody, even outside the salon, how to pick up a box correctly.
Right, because you have your own salon, you're
I
going to have
have my
supplies
salon.
coming in, right?
True
So,
that.
so let's do that.
Okay.
So what we're going to do, this is a typical box, right?
Okay.
And even though somebody knows the rule, lift with your legs and not with your back.
Yes.
Normally, what I see them do is this.
You talk. That's not right, Dr. G.
That's not right. That was all back, no legs. Okay?
Yeah.
As a matter of fact, there's a stretch that a lot of our kids do.
Okay.
And they do them in school where they bend down like this. All that does is it pushes those discs back. So we've been trying to get rid of that type of stretch.
We call
okay?
them the cotton pickers. We go front and back, but it was all that stress.
So we want to definitely eliminate that. To lift this box, normally if someone is aware of the rule, lift with your legs and not with their back, they're going to do something like this. Now, did I lift with my legs only, or did I use my
You
back
still
as well?
use your back.
I use my back as well. The reason is this. There's one little thing that they have to do.
Okay.
Once they have the box in their hands, if they bring their head level and then they lift, that's all legs.
Oh, okay. I saw that. It was a big difference.
That's it. And so that little thing of just bringing your head level and then using your legs to lift it up, that's it. That's one example.
Yes.
So when I go and I'm helping a person or a company reduce their injuries and reduce their recordable injuries, we like to customize what they need.
Okay.
And so depending on how I observe and people are working, we want to make sure that they can work safe, whether it's
Yes.
back safe or sitting safe.
Yes.
And in your case, here, we would want you to be back safe.
Yes.
Okay, so that's what we have for that.
That is great information. And you are also able to make some of the suggestions that I can actually use at home, not just while I'm working.
Right, and it's going to be the same thing. Imagine taking your groceries out of the shopping cart. Imagine taking your groceries out of the back of your
Yes.
car. Be aware of how you're using your body,
Yes.
because that stress and tension, the body's really good at just piling it on. And if you don't take any steps to de-stress yourself, what's it going to do? We're going
It's
to
going
wait
to show
till
up later.
we're going to wait till that it's the last straw, right? We're going to wait till that's the last thing that puts you
A
over the
straw that
edge.
breaks the camel's back.
And
Yeah.
then where are you going to be?
Yeah.
Then you can't work, then your back's locked up, and then you need help,
Get
right?
spasms. And I've had that because I realized doing it correctly.
And don't get me wrong.
Yeah.
If that were to happen, right,
Yeah.
and you need help, obviously my chiropractic aspect and the
Yes.
acupuncture and all that, we can help, but we want to prevent.
Prevention is the key.
So even if that happens to you, I don't want you to prevent it from happening again. That's right.
Again. I
That's
love
right.
that.
Yep.
I love that. As you can see, great information that Dr. Gutierrez has shared with us. Like I said, wow, it's just not things that we can do while we're at work, but he's even shared us things that we can do once we are out shopping, washing dishes at home, or just in our everyday life. I know that someone's going to see this show, Dr. G, and they're going to want to get in contact with you because you can only share so much in the parameters of this show. Can you tell them how to get in contact with you? If you have a website, phone number, please.
So here in San Antonio, my office number is 210-366-4357. And my website, I have two of them. One is called Spine and Health Institute, but we have askthesanantoniochiropractor.com. So that's askthesanantoniochiropractor.com. When it comes to injury prevention, reducing recordables, DOT physicals, drug tests, alcohol tests, that aspect, what they call occupational medicine, that would be AlamoCityHealthAndSafety.com. So AlamoCityHealthAndSafety.com.
You've heard it here, and I really recommend that if you have any troubles in the area of chiropractic or even his new enterprise when it comes to the drug testing with the please contact Dr. Gutierrez. He is amazing. And thank you to his lovely wife, Lorena, for being a model. But you've given me even so much information that I'm going to start practicing, because the years of being a stylist when I was much younger and naive of wearing the heels and working cute have really shown in wear and tear on the body. So hopefully this information will be for someone that they'll start practicing a little bit more safely.
And thank you for having me on your show.
Thank you so much. This is Main Health. This is Stephanie Anderson saying until next time, take care and be blessed. Bye-bye.